Are you a nursing student, tired and struggling with late nights, many cups of coffee, and an anxiety that just won't go away? Then you're just like my friend Natalie. In a moment, we're going to hear her story and how she responds when she hears this magic word, Lorazepam.
Hey, are you okay? I'm really stressed about the exam on Monday. Nursing school is so demanding. There's just not enough hours in the day.
I totally understand that. It is a lot.
And on top of that, I have such a hard time sleeping at night. Maybe if they'd prescribed me Ativan, it would help me rest the night before the exam.
I feel like we just learned about Ativan. Isn't it a benzodiazepine with the generic name Lorazepam? And I think it can be used to treat certain seizure disorders as well. And I remember reading somewhere that it can be used for sedation before surgery, so we're probably going to need to know that.
Maybe I just need it as an IV or an injection.
I remember reading about all the adverse effects of benzos, and I think there are different dosages that can be taken to treat anxiety disorders and insomnias.
I do remember reading that.
And there are a lot of other things that you can try too before resorting to anti-anxiety agents like lorazepam, especially since they're mostly used for short term. So maybe you can consider using some non-drug therapies like limiting your caffeine intake, practicing some restful activities near bedtime, especially on the night before the exam. Setting up and practicing good sleep hygiene can be helpful. Talking through your anxiety with a friend or a counselor, or even seeking cognitive behavioral therapy. Sometimes listening to some good music can be really relaxing and helpful as well.
Lorazepam is usually given as a tablet and best to taken before bed. Take with food in order to decrease GI effects. Some people might experience daytime sedation and should avoid operating heavy machinery until they know how they will respond. Sleep driving and other complex sleep-related behaviors are also a possibility. Inform your doctor immediately if you experience any paradoxical reactions such as rage, excitement, or heightened anxiety, as these may be reasons to discontinue lorazepam. With short-term intermittent use of no more than 3 to 4 nights a week, physical dependence is rare, but has been known to occur, resulting in potential drug-dependent insomnia during or after withdrawal of the medication. Lorazepam is not to be used in pregnancy or while breastfeeding. If you think you are pregnant or are interested in becoming pregnant, consult your prescriber, as lorazepam should be discontinued. Do not drink grapefruit juice or consume high-fat meals while using lorazepam, as these reduce the absorption, decreasing the effects. Concurrent use of other depressants such as alcohol, opioids, and antihistamines should be avoided, as these can heighten the effects of lorazepam, leading to respiratory depression, coma, and even death. Monitor respirations for up to 15 minutes after IV or IM administration, and keep emergency resuscitation equipment readily available. Lorazepam is a Schedule IV controlled drug and must be dispensed accordingly. If you have a history of drug abuse disorders or suicidal ideation, lorazepam may not be right for you. In case of lorazepam toxicity, your doctor may use flumazenol or gastric lavage, followed by activated charcoal and saline cathartics. When you want to stop taking lorazepam, doses should be tapered off in order to reduce the risk of withdrawal symptoms. If this list feels daunting, maybe try alternative treatment methods before deciding to give lorazepam a try.
Truly, my colleagues and I rarely prescribe lorazepam. It has so many adverse effects, and it's really only meant for short-term use. It's usually just a band-aid treating symptoms instead of the deeper problem.
Lorazepam.